everyone, and thank you for joining our conversation today about disrupting menopause. This is a topic that we don't have to look very far to see evidence of disruption happening. In fact, it's a really exciting time overall for women's health, and this conversation could not be more timely. Let me just first introduce our two panelists. Joining me today are Jill Angelo, the CEO and founder of the women's healthcare company Genève, and Jennifer Weiss-Wolf, who not only sits on the board of Let's Talk Menopause, but she is the executive director of the Birnbaum Women's Leadership Center at NYU School of Law. Thank you both for being here today. I want to start by talking about some news that came out last week. I'm not sure if folks saw, but there were two really big steps forward when it came to menopause last week, one of which was a new study that came out that made a statement that may not sound so groundbreaking. Basically, a group of researchers said that menopause hormone therapy is generally safe for most women. That's a pretty conservative statement. But it was actually pretty revolutionary and something that people had been waiting for a long time. So Jill, I would love for you to share your thoughts on that study and maybe even give us some of the context and background about the very complicated relationship that has existed between menopause hormone therapy and patients and doctors.
Yeah, absolutely. I think for any of you who were here throughout the day, there was a little bit of a comment around the Women's Health Initiative and the study in 2002 that came out. Really, again, a study that was done not 100% appropriately in women 65 and above that found a lot of risks associated with hormone therapy or HRT. And, I think as a proponent of menopause treatment and care, whether that's medical treatment or lifestyle care, Genève, we have OBGYNs and registered dietitians that work collaboratively on the whole person. I'm a huge advocate for HRT and the benefits that it brings to women. Obviously the study in 2002 was not 100% done in a way, and actually the whole rationale for that study was studying long-term chronic health issues in women. It wasn't set out to debunk or find fault with HRT. That was not the goal originally of it. And so ever since it came out and both the utilization of HRT just plummeted based on fear across physicians, across women for the last almost kind of 2 decades. Since that time, there's been continued efforts to try to re-educate around the benefits of HRT. And last week was the second of 2 studies that have come out since to really try to debunk that original study and really demonstrate the value and the power of HRT. And a kind of a simple mental model that our physicians always share with me in Genève is very much like, if you start hormone therapy and you continue on it and not take breaks, start and stop. It's the start and stopping where it becomes a little bit more dangerous if you don't have contraindications like a history of breast cancer or other risks in your family. And so, as a proud user of a low-dose estradiol patch, my husband calls it the happy patch. I love it. It helps me sleep. It keeps away my hot flashes. It also just really has improved my anxiety and my mood. I'm a huge advocate. And I think one last thing around the study and what I hear from women time and again is mostly the women now that are in maybe their 60s or their 70s or 80s, where they're like, wow, the bone loss that I have experienced, that I could have had the support of hormone or estrogen therapy or hormone support, and I could be feeling better now, or wouldn't be suffering from osteoporosis now. That's the category, that's the group of women that I think has really been the victims, unfortunately, of a study that was miscalculated and misread and misinterpreted. And it's just taken too long to re-educate everyone on the benefits.
And I think this whole experience really highlights the importance of greater research into women's health. And that brings us to the second bit of news that came out last week. And Jennifer, you were actually there in Washington, D.C. for the introduction of some legislation that could be really impactful. Talk to us about what that is and what you hope to get out of that.
Yeah, so if folks saw the headline last week, a group of 17 U.S. senators introduced a new piece of legislation to both focus on research and federal research dollars towards menopause, as well as menopause education. I think what's really important and interesting to do, though, is to tie it to what Jill was just discussing about the WHI. The place that we're in today in 2024, where we are so lacking in research, where medical providers aren't properly trained in how to understand and treat patients with menopause or how to prescribe hormone therapy, the idea that there are these other sort of burgeoning movements around menopause, whether it is workplaces and CEOs wanting to create benefits for employees who are experiencing perimenopause and menopause, or companies that are providing and selling products. All of the entire ecosystem we're in right now is actually thanks to the WHI debacle. It's not disconnected. It's not even that the government always ignored or marginalized menopause. There was robust attention paid to it in the 90s, hence the creation of a study as large and as expansive as the WHI. But it is the faulty way that it was interpreted and rolled out to the public that has created this gigantic, empty echo chamber that we exist in now. And the kinds of solutions that are needed do really start with the kinds of legislation that we're seeing introduced. So last week it was the Senate bill, and like as I said, it focused on research and education. Folks may not have seen that a couple months prior, starting in December 2023, 3 bills were actually introduced in the U.S. House of Representatives too. And I should add that the 3 bills in the House and the Senate bill are all bipartisan. I think we can agree that this is an issue that crosses party lines. I do a lot of menstruation-related advocacy too, and I'll always joke, we all bleed red. And the idea that menopause will draw bipartisan support, I think, is something that we should really be thinking about in a proactive political way when we think about what kinds of things are achievable by our government. And I will also point to, in March of this year, during Women's History Month, the President of the United States both announced at the State of the Union an investment in women's midlife health research, and then signed an executive order that goes across the federal government from agency to agency, requiring that they invest in everything from research to focus group understanding to public education to medical education when it comes to menopause. I think that's all far more radical than we might even give it credit for.
And it took till 2024 to even have this kind of investment.
And really the loss of what occurred between 2002 and 2024 is so much of why we're in this situation. I think it's really important to underscore that. So yeah, that's a little bit of the history of what happened last week and where it came from and why.
Yes, so all of these research efforts and investments, huge step forward, but will not make a difference if women cannot get the health care that they need and deserve. So Jill, you are looking to disrupt the healthcare system for women through your company, Genev. I'd love for you to share with us the founding of your company, where the idea for it came from, and what you hope the broader system might learn from some of the innovations that you're introducing.
Absolutely. I think you just heard a panel on entrepreneurs. You get help from others. Obviously, you heard early on, Genev is very much a product of iFund Women. So thank you, Karen, and the iFund Women team. Initially, when I was starting the company, I started Genev about 8 years ago. And before that, I had a 20-year career in technology. So I did not come out of the healthcare industry. I started Genev out of the need for a lack in women's care around menopause. And when I started the company, I really didn't even know how to solve this issue. We started first with a lubricant addressing feminine dryness, and then started publishing a lot of education and content. And at that point, we needed to raise capital. So, I got the help of iFund Women, and we started the early stages as a startup. And over time, we continue to hear from women. I feel dismissed by my doctor. I don't feel heard. I have a lot of questions. Who do I go see? And over time, one of the content collaborators that I was working with is a woman named Dr. Rebecca Dunsmore-Sue. She's a physician and OBGYN based in Seattle, Washington, which is where I'm based. And she said, I've always wanted to create a telehealth company for menopause care. And I said, well, I've got a menopause platform, let's do it. And so in 2019, we thought, how hard can this be? Well, I learned the world of telehealth regulatory. I had with the help with an incredible regulatory attorney that worked on the budget that I had to work with. And slowly, bit by bit, we started bringing together both OBGYNs and registered dietitian nutritionists. Our care model is integrated care. Menopause is not just a medical thing to treat, and it's not just a lifestyle change. You need both as women. And so our care providers really support women where they're at, whether they want the medical treatment and or the lifestyle change. And we built the clinic. The pandemic hit, telehealth was hot, and we quickly grew to over 50 states in terms of supporting patients, no matter what state they're in. Today, we have a national team of clinicians, doctors, as well as dietitians. And in 2022, we exited. We were acquired by a company called Unified Women's Healthcare, which is a large women's healthcare company comprised of over 900 OBGYN clinics, like in-person clinics. They deliver 1 in 23 babies in the US. They also have a fertility company, CCRM, and they have 30 clinics, fertility clinics throughout the US. By bringing Geneva into the fold, we now can support women end to end from the time a young woman has her first PAP exam in the office with a physician at the age of 15, through wanting to plan a family, get pregnant, have a baby, go through postpartum and into menopause. And so it's just, you talk about the disruption and the innovation early on. We were probably one of the first voices, if not the first, talking about menopause. And raising capital was a whole nother challenge, not only in a male-dominated world, but in a world where people didn't really know what menopause was. Now at this point, the first moment was disrupt independently because no one's doing anything. But now to fully drive access to care, we have to join forces with traditional healthcare. And that's what we've done by joining Unified. We are now part of working with insurance, working with in-person clinicians. We're disrupting kind of from within, because there's a point where you have to transition to join the masses and lock arms. And that's really at the point, that's where we're at now. And it's just really been rewarding and an incredible journey to be on.
Well, that's a great example of how the private sector is stepping up to shift menopause care in this country. What about from a policy perspective, Jennifer? What are you seeing? What are the conversations? What would you like to see happening in those discussions that you think could really move the needle?
I love the phrase you just used, disrupting from within. And I'm sort of thinking about that even from a policy perspective. So in describing the bills that have been introduced, they really sort of start to at least get to the heart of what we need to be talking about, which is what we have shared knowledge about, what we know, what we don't know, where the research is lacking. But in sort of linking to the WHI in those first comments, it's also back to disrupting from within. It shows how it's all really interconnected, how doctors are taught, how we're taught as everyday people, whether it's through the sex ed we receive in school or public service announcements and other ways that we get information now. And the disruption really has to come from understanding that the system that we're in is broken, that there are absolutely private sector solutions that are urgent for people's needs here and now, but that there's also a systemic view that we can take. And we can find these gaps almost everywhere. So you had mentioned that I'm on the board of Let's Talk Menopause, and that group, for folks who aren't aware, it's a great public education platform and resource. But we think a lot about public policy and what the different connectors are. And there's some things that just don't even feel like they'd be such an obvious disconnect, but they are. So everything from how the products we use are labeled and who makes those decisions, the FDA, that how the commercial industry is regulated, the FTC has oversight of what we know, what we don't know, what kinds of misinformation we can challenge. There are actually policy solutions for almost everything. So I kind of subscribe to this meta view that the research and overall investment in both in menopause research and conversation and education has been lacking. But then there are all these individual or smaller ways that it also plays out and creates overall an unsatisfactory experience for most people. If it's because of the tube of vaginal estrogen that they finally got their doctor to prescribe has a skull and crossbones on it, which it kind of does, that has to be changed. When it's that there can be companies selling, you know, supplements and nutritional products, and you really have no idea what's good, what's not, what's real, what's not. There's a celebrity on it. Does that make it something I want? There's actually things federal agencies could do to help us better process all of that. So that's where I come in. I'm a wonky lawyer. I get to hang out with all the groovy doctors and innovators and disruptors. And I get to call myself a disruptor now too, but really I'm just a very boring lawyer.
You know, just to bring that to life, you know, policy and the importance of it in the private sector, because it is hip and cool and where it's at. You know, just even last week with the legislation that Jennifer just talked a little bit about with the bipartisan, you know, senators that got together and representatives to push forward menopause legislation. That kind of work is going to open up access. So what I did immediately coming out of that, one of those senators is Senator Patty Murray, who's from Washington State. I live in Washington State. She is my senator. I reached out to her office and I said, what can we do together to put more pressure for me in my world on payers or insurance companies or even, you know, organizations, Medicaid, Medicare, that will open up access to women, because at the end of the day, the way our healthcare system works, this earpiece is a little crazy, but the way our healthcare system works and how our healthcare is paid for, opening up access through those channels and putting the influence on them will come through policy. And so I think that's where the worlds come together.
I actually want to jump in here and go on, so mine is now falling off too, or yours. I'm writing a book. It'll be coming out next year. It's called Period Full Stop, The Politics of Menopause. And it is basically considering this whole political story, how we got here and what the policy path forward is. So among the things I learned in researching it was that a decade ago, or a little more than a decade ago, a group of members of Congress, women members of Congress, similarly had a press conference, and they put forward a bill mandating that all insurance coverage, public and private, cover menopause hormone therapy. A bill that went nowhere at the time, but look at the power we have now to resurrect that bill. That's actually been done in one state in this country. I don't know if folks can guess which it is. It wasn't an obvious one to me, but it's the state of Illinois. And menopause hormone therapy is required to be covered by public insurance for women who've gone through earlier premature menopause on account of cancer treatments. So it's fairly narrow, and I'm sure it's because a person in the mix had that happen in their family, and that's how a lot of legislation happens. It's not real until it happens to the lawmaker. But that's a real window opening. It's a start. So this is where we're at, and sharing these ideas across disciplines is disruptive in itself, because that's how we'll think of what these policies are and should be.
So progress being made, a lot of work left to be done. I had the privilege of interviewing Maria Shriver a couple of weeks ago, and she said that she is super optimistic about the future because she feels we're in this golden age of women's health. And I thought that was a really, really rosy way of looking at things, but I appreciated it. I'd love to get your reaction to that. Do you think we are in a golden age of women's health, and why or why not?
You know, yes. Why? I think so, absolutely. There have never been more women's health startups addressing niche or parts of women's health. Like, you hear if you're in the workplace, you hear of all these point solutions and lots of femtech startups. That's a good thing. And even if there's a PCOS company and a menopause company and an endometriosis or a chronic care company, they are bringing new treatments and innovation to life. And over time, we need to consolidate it and bring it together so women's comprehensive care is given the support it needs. But I think that's part of the golden age. I think this legislation and additional funding is part of the golden age. There's more research. You know, I'm part of the Women's Brain Initiative. It's at Weill Cornell, led by Dr. Lisa Mosconi, studying, you know, Alzheimer's and dementia in women. And it's been a multi-year journey, and it's fascinating the investment that is now happening to discover these things for women. So I'll say yes, I'll agree with Maria.
Jennifer, I'll give you the last word.
Okay, really quickly. I'm not so sure. I think that it's really interesting. Generationally, in the 1990s, that was also kind of treated as a golden age of women's health. And if you go back,
Everything old is new.
everything old is new. It was like the baby boomers are coming into their own and they're menopausal, and this is going to change everything. And then I'm going to be a broken record, the WHI. But I find it actually kind of humorous because a lot of the headlines now speak to the power of Gen X, right? I'm Gen X, I'm 56, so we're not going to take it. I'm like, our generation has been roundly ignored and given credit for nothing, pretty much. So if we're going to step up and take credit for being the disruptors of menopause, I'll take it. So that'll be my somewhat optimistic answer.
Well, you have your marching orders. Go out there and disrupt. Thank you all for joining us today. Pleasure.